If somebody needs to go for radiotherapy, no appetite, wow, your family very concerned. I jie ham meat lah, I bay ham meat lah, ma zai zhu ham meat lah. Then they don't know tomorrow want to cook what, the day after tomorrow want to cook what, want to go shopping and buy what. So don't worry, I'm here to tell you now how to manage your diet, what can and cannot eat, how do you go about all these changes in your taste during radiotherapy. Hi, I'm Dr. Doris, clinical oncologist, and I'm here to guide you on your cancer journey. Okay, so first things first is sometimes during radiotherapy, your taste change. So if you're taking care of somebody with radiotherapy, don't feel insulted if they don't like your food, okay? Because the taste can change, and sometimes even water tastes horrible, right? So we may not understand, but for these patients, water also can taste weird, right? So, but you need enough fluids, okay? I recommend probably about 8 to 12 cups of water a day. But if you can't take it, you can try things like flavored juice, flavored water, or you can actually just cut up some, apples and cucumbers and infuse it in the water so the taste of the water is slightly different. You can try taking fruits that has high water content such as watermelon, or if you can take soups, but a lot of people do not like oily or salty stuff during radiotherapy, okay? So you can try using all these methods to try and improve your water intake. As for food, we would probably say even your taste change. Sweet tastes salty, salty tastes sweet, something tastes bitter, something tastes smelly. It really depends. This is very weird. It doesn't happen only if you have radiotherapy in your mouth. Even if you have radiotherapy elsewhere, some patients will feel as though the taste has changed. So you have to work according to what change you feel. If you feel that everything is bland, no flavor at all, some people tell me it's like eating cardboard, then you add some spices or some herbs, to help improve the flavor. You don't have to go no salt, no MSG, no everything inside, okay? So things like herbs such as garlic powder, rosemary, a little bit like salt, it can help improve the taste of the patient. But patient by patient. Some patients, when they take that, they feel as though they want to vomit, then don't take lah, okay? So these are ways to help improve the taste. Some patients cannot take the strong taste because the mouth has ulcer. The moment pepper touch the mouth, they feel really painful. So what you do, you have to go to something more bland, like smoothie, milk supplements, right? Just porridge or mee sua or things like that, something bland, okay? Because they cannot tahan the taste, right? And I think only patients can understand this. When it's so painful, sometimes you can't even swallow their own saliva. Okay, I'm not scaring a lot of you. This is nothing to do with radiation elsewhere. If you have radiation in the mouth, you get a lot of mouth ulcers. So for these patients, what you can try and do is you can try to take blended food. So get the porridge blended, or you can drink more milk. Now we have a lot of milk supplements that you can actually just survive on these milk supplements while you're undergoing treatment. It's very important also to have protein intake, okay? You need enough protein to build your body. You don't have to go all vegetarian, okay? But some patients cannot eat meat. They cannot tahan the meat smell, or their mouth becomes very painful when they chew the meat. So if you cannot do that, what do? You go for alternate source, like milk products, soy, you can eat tofu, tau gua, eggs, and certain vegetables are also high in protein. So you need to make sure that you also have enough protein intake. A few things to avoid is, please avoid alcohol. Alcohol can actually make your mouth dryness worse, okay? Some people are worried, coffee lovers want to know whether they can have their, drip coffee lah, Starbucks lah and all. So you can, okay? But if you can, you need to cut it down, all right? So ideally, maybe once or maximum, like you really need to twice a day, because coffee can also cause more dryness. It can change the taste, and also it can cause you to lose more fluids because it's a diuretic. Try to avoid unpasteurized milk. Okay, so usually the milk that you buy in the supermarket, they're usually all pasteurized, the milk and cheese. But try to avoid anything that has mold, cheese that has mold, anything that is not pasteurized. Please avoid raw foods, okay? No oysters, steak, rare or blue, sashimi. Try to avoid it during radiotherapy. So that's basically it actually. So you don't have to pantang too many things, okay? I think different people have different taste changes, different ability to eat, different tolerance. If you can eat everything, very good, just eat anything. But if you cannot, these are ways to help you during the radiotherapy. Okay, so now you know what to eat, right, during radiotherapy. Now I'll tell you how to prepare your food, okay? Some people are worried, right? How do I prepare all this food for radiotherapy? So actually, it's just very simple. Cleanliness, cleanliness, cleanliness. Okay, so all of us are very used to washing our hands now. Very importantly, please wash your hands when you prepare food for people having radiotherapy. Okay, because the immune system sometimes can be a bit low, so they can get infection easier. Right? Try to avoid preparing raw food and fresh vegetables at the same time. If you can, if you've got 2 chopping boards, try and use the meat in 1 chopping board and the fresh vegetable in 1 chopping board. Apart from that, as long as you are clean, you're using boiled water or cooked water, and you're doing everything clean, then it should be safe. If you found this video helpful, like and share this video. I'm Dr. Doris Chow. Bye!